So first I'm going to go ahead and knock on the door before entering. Hi, my name's Sahara. Can you tell me your name and date of birth? I'm going to match her bracelet to the mark. Make sure I have the right patient. So I'm here to do a postpartum assessment. Is that okay with you? She tells me it is okay. So I'm going to go ahead and provide for privacy. I'm going to wash my hands and glove up. So first, I would like to know, how's your pain right now? Is it kind of manageable? She tells me that it's managed to her expectations. Then I'm going to ask her if she needs to urinate right now, and she tells me she does not need to urinate. If she did, we would want to do this before the assessment. So first I'm going to go ahead, I'm just going to expose your breast. I'm looking for any redness, any cracks or bleeding. I'm making sure you have on a supportive bra, looking for engorgement. I would ask if she's bottle feeding or breastfeeding, and if she's bottle feeding, I would want to educate her on ways to not stimulate milk production and ways to deal with engorgement since she's bottle feeding. And then I'm going to go ahead, I would cover her breast up with the gown and move the blanket down, and then move the gown up just to expose her belly. So I'm going to go ahead and listen to your bowel sounds. I am going to listen to all 4 quadrants. I would listen up to 5 minutes if I thought I didn't hear any bowel sounds, but bowel sounds are present. So I'm going to go ahead and examine your uterus. I'm going to go ahead and stabilize the bottom so it doesn't cause any invert uterus between the hips. Go from the sternum down to find the fundus. I'm going to feel the uterus. It should feel like a stone. A boggy uterus is a risk for hemorrhaging. If it was soft right now, I would go ahead and massage it to try to harden it back up. And then I'm going to go ahead, cover up her belly. I'm going to ask her, have you had any bowel movements today? Are you urinating like usual? Are you passing gas? She tells me she has no issues, so I'm just going to check her arms for any warmth or edema. I'm checking for tenderness. I'm checking for edema on her face. I'm going to go ahead and check her legs. I'm just looking for warmth or edema, signs of a DVT. And then I'm going to go ahead and ask her, can we turn on her side? I'm going to help her and keep her covered up. And then I'm just going to, right now I'm looking for hemorrhoids, lochia, and your episiotomy. So I'm going to go ahead and examine the pad in her underwear. If it was lightly or moderately drained with blood, that would be okay. But if it was like a heavy flow, if the pad was full within an hour, I would want to notify the healthcare provider. If it was dirty right now, I'm going to remove it from front to back. I would do peri-care that way too, front to back, to avoid risk of infection. I'm going to look at her episiotomy and make sure it's healing properly, and make sure she doesn't have any hemorrhoids, or if she did, check on those. So she could go ahead and turn back on her side. And I'm going to go ahead, remove the dirty gloves, wash my hands. I'm going to ask her, how are you bonding with the baby? Do you have any questions or concerns about your baby? And she tells me she doesn't. So I'm going to make sure her bed's lowered, she has her call light. I'm going to make sure she doesn't need anything, her pain's still manageable, and then I will go document.